Hi there, in this video I'm going to be demonstrating how to do a subcutaneous injection. So the first thing that we'll do is do our first medication check. So this is usually done by comparing the MAR against the prescriber's order, but since there's already two initials on our MAR, one by the transcriber and one by a nurse, we can rely on the MAR for its accuracy. Also, I've looked into my patient's chart. So my patient is currently unable to ambulate, so that's why this medication, heparin, is given as a prophylactic treatment for DVT, which I have no concern for. That is appropriate. So we're going to go ahead with our first check. So what I'll do is I'll compare the MAR against the medication label on the container that I've the medication I have pulled from our supplies. So the things that we're looking for are making sure we have the right patient, right drug, right dose, right route, and right frequency. So this medication here is for my patient nursing Jake, and then the drug's name is heparin, and then the dose is 5,000 units. So on the vial says 5,000 units for 0.5 ml, and then the route is subcut. On the vial says single dose vial for IV or subcut use, so this is safe to be given through subcut. And then for frequency, it is twice a day, so the dose is scheduled at 8:30 and another one at 20:30. So currently it's 8:15, and this will be the first time that this patient will receive this medication for the day. So we also want to look at the expiry date of the medication, make sure that it's still good. So on here it says the expiry date is July 2022. Today's date is March 10, 2022, so it's not expired yet. And then we also want to check if our patient has any allergies. On the MAR, it's left blank. So we would ask again on our patient's bedside to make sure that they don't have any allergies. Or if they don't, then we would put it on the MAR. Great. So some more information about my drug. I've done my research. So heparin is an anticoagulant. Its mechanism of action is it prevents the activation of some of the clotting factors, which then prevent clot formation. So one of its uses is as a prophylactic treatment for VTE, and that's what it's prescribed for. And then for the dose, for safe dose through subcutaneous route, it is at 5,000 units every 8 to 12 hours. So it's prescribed at 5,000 units twice a day, which is still within the safe dose limit. And then for the common side effects, we have rash, fever, and bleeding. So the things that we want to monitor for prior to administering the medication to our patient, we want to look at, we want to assess their vital signs, if they have any signs and symptoms of bleeding, fever, if they're having a rash, and then we can also look at their blood work. If they've done a recent blood work, then we can look at their hematocrit, their platelet count, or we can look at their APTT or PTT if that's available. And then after administering the drug, we want to assess our patient again for vital signs, looking for those signs and symptoms of fever, rash, and bleeding, either externally or internally. So the next thing that we want to look at is our parenteral drug monograph. So the drug that I have here is heparin. So we're looking at the generic name of the drug. The class is anticoagulant. Some drugs might have an alternate name. This one doesn't have one. And then we want to be careful when administering the drug, this drug, that it is safe for a patient. As you can see on here, it says high alert medication. And then we, as student nurses, we want to make sure that we are allowed to give this medication. So it says on here for subcut use, may be administered by a nurse or a student nurse. So that's good. And then for the dose, always good to check that we're within the safe limits. So for venous thromboembolism prophylaxis, which is what it's prescribed for, the usual dose is 5,000 units subcut every 8 to 12 hours. So that's what's prescribed, so that's good. And then for the subcut route, we must administer the medication undiluted. So we're not diluting it or anything, so that's good. And then for the potential hazards, some of its potential hazards are bleeding and thrombocytopenia. And we understand the mechanism of action of our drug. It prevents clotting. That's why it can increase the risk of bleeding and thrombocytopenia. So before I drop my medication, just want to explain more about subcut use. To get the volume of medication that we need, we would look at the dose that is required, so 5,000 units, and then we look at the concentration of the drug. So it says on here 5,000 units per 0.5 ml. So the volume that we need for this drug to get 5,000 units is 0.5 ml. And for subcutaneous route, the volume of medication we're allowed to give is between 0.5 to 1 ml. So we're still good. The volume is appropriate for subcut injections. And then for the locations of where we want to inject, we can either choose the abdomen or our patient's posterior arm. We can choose the thigh or the scapula. But for our patient, or for this medication rather, it is recommended that we administer it to our patient's abdomen. So that's what we'll do. Okay. And then, I'm now going to drop my medication. So I'm going to do a hand hygiene. And then this vial here is not brand new, but if I was using a brand new vial, then we would just pop the cap off of this. And then we would clean the rubber seal, the top of the vial with an alcohol swab. And we want to wipe for a good 30 seconds just to make sure that it's really clean. And then before we drop our medication, we want to make sure that it's dry. So let's pretend that I've wiped it down for a good 30 seconds. And then we're going to get our needle ready and our syringe. So I have here a 3 ml syringe. And then for drawing up the medication, I have a blunt fill needle. This one doesn't have a filter since we are drawing up medication from a vial. We don't need a filter, but if we are drawing up medication from an ampule, then we would need a blunt fill needle with a filter. And then for the needle, I've chosen a 25 gauge needle. So with subcut, you can either choose between 25 to 31 gauge, and then within 25 to 31 gauge. And then for the length, I've chosen a 5/8 of an inch for the length. But for subcut, you can either choose half of an inch or 5/8 of an inch needle. So this is what I've chosen. So that's dry now. So we're gonna drop our medication now. So I will be connecting my syringe to my blunt fill needle and then secure that in place. We're gonna draw up half an ml of air, and then we're gonna inject that onto our vial. So I'm gonna take the cap off, and then I'm gonna inject the air. So I'm just letting that medication go into the barrel of my syringe, and then I'm just gonna pull it a little over the 5.5 ml that we need, just because there's air bubbles, and we want to get rid of that by tapping. Okay, so then I would inject back the excess amount of medication back into the vial, and then we'll remove this, and then recap our blunt fill syringe. And then we want to switch to our injection needle. But before we do, we want to make sure that all of the medication are within the barrel of the syringe. So to do that, we'll pull back the plunger, and then we'll remove our blunt fill needle. This will go straight into the sharps disposal container, and then we'll connect our injection needle. And then we want to recalibrate back to the correct volume of medication that we need. So 0.5 ml. Just want to show that onto the camera that we have 0.5 ml. And then we want to make a label right away. So the drug's name is heparin. The dose is 5,000 units. Volume is 0.5 ml. Concentration is 5,000 units per 0.5 ml. Today's date is March 10, 2022, and the time is 08:15 hours, and my signature. And then we want to label our medication right away. We're going to stick this onto the cap of the needle, so just to make sure that we can still get a good view of the markings on the syringe. So then now we're going to perform our second medication check. To do that, I'm going to compare the MAR against the medication label that I've prepared against the medication that I drew up, and with the medication label that we drew from. So again, we want to make sure that we have the right patient, nursing Jake, And then the drug's name is heparin. And then for the dose, we need 5,000 units. So this one is 5,000 units per 0.5 ml. And then I have on the syringe 0.5 ml. And then for route, we're going through the subcut. And then for the frequency, we're doing twice a day. So this will be the first dose for the day for our patient. Okay, so we've performed our second medication check. This vial is actually a single dose vial, so this will just go straight into the medication waste disposal bin. And then we're gonna head into our patient's room now. So when we head into our patient, we wanna make sure that we bring our MAR, the drug research, and then we wanna make sure that we don't lose sight of the medication. As you can imagine, in a hospital where there's a lot of patients, things can get easily switched up by accident. So we're gonna head into our patient's room now. So we would knock and introduce ourselves. So knock, knock, knock. Hi there, my name is Alex Cruz. I'm a year 2 student nurse at the University of Manitoba. I'm here to administer your medication for you. Is that okay? All right, thank you. Can you tell me your name and your date of birth? Name is Nursing Jake, and then date of birth, January 1, 1960. Great, that's what I have here. And I'm just double checking the FIN number here as well. So 312-654-987, that's good. And also, do you have any allergies? No, you don't? Okay, that's perfect. So Jake, I'm going to take a moment here to double check that I have the right medication for you. Is that okay? Thank you. So we're doing a third and final check at the patient's bedside. So again, we're checking to see if we have the right patient, Nursing Jake. And then the drug is heparin. The dose is 5,000 units. And then it's 5,000 units per 0.5 ml. On the syringe, I have 0.5 ml. And then the route is subcut. And then the frequency is twice a day. All right, perfect. So Jake, this medication that I have here for you, it's called heparin. This is a blood thinner. It was prescribed by your doctor for you because you are not able to move around as much. So this is going to prevent the clot from happening. Sorry. And then, so this medication here is coming on injection, and this is recommended that it goes into your abdomen. Is that okay? Okay, Jake says yes, that's fine. Okay, so then before I already looked at your chart, I checked your blood work, make sure that this medication is safe to be given to you, and then before I give you the medication, I'm gonna check your vital signs, and then some of the side effects of the medication can be fever, nausea, and bleeding. So after the drug has taken effect, in about half an hour, I'll be back again to assess your vital signs and also to check if you are having any signs and symptoms of bleeding or if you're having any rashes. But if you start experiencing any of these symptoms before I'm back in half an hour, you have your call bell within reach, and you can let us know right away. Does that sound like a plan? All right, great. So then, just more information about the drug. I would recommend not taking any over-the-counter medications while you are on this heparin drug. Not unless the medications are ordered for you by your doctor. And also, when you're brushing your teeth, I would recommend using a soft bristles toothbrush. And then if you are going to shave, I would recommend using an electric razor, just so we can avoid bleeding from happening. Does that sound okay? All right, great. So the way that it's going to work is I'm going to inject on your abdomen, and then the medication will be deposited on the fat tissue under your skin. So it might hurt a little bit, but just a little bit. And then we shouldn't see any blood coming out. So are you good with that? All right, thank you. So I also, just to show you clearly how I'm administering the injection, I'm going to take my patient closer to the camera. So Jake, we'll move right here just to demonstrate what I'm doing. And then I'm going to lift your gown up a little bit so we can expose your abdomen. Thank you. So for landmarking, we're going to use the patient's umbilicus. So this is my patient's umbilicus, and then I'm going to go 5 centimeters away from it. And then this will be my injection site. And if you're giving this medication, if you're giving multiple doses of it, let's say if for Jake he needs another one later on to the day, then we want to rotate the injection sites. So just to show my landmarking, so this is my umbilicus. Then I'm gonna go about 5 centimeters from my umbilicus, so this will be a good injection site. And then just to explain how I'm gonna do this, so my patient doesn't have a lot of adipose tissue, so we wanna grab at least an inch of skin, and then we will go in at a 45-degree angle. But if I was doing this on a larger patient, maybe if they have a lot of adipose tissue, if I can grab at least 2 centimeters or 2 inches of skin, we can go in at a 90-degree angle. But for our patient, we'll go in at 45. And then we want to grasp the skin with our thumb and our ring finger, and then we can use our index finger and middle finger to stabilize the needle. And then we'll also rest our ulnar aspect of our hand on our patient's body. That way we can stabilize the needle. Okay, so Jake, just getting ready here to administer the medication. I'm gonna do hand hygiene again. And then I'm gonna put gloves on. And then I just wanted to mention that for injection, we don't wanna massage the injection site after we've administered the medication. So like I said, we shouldn't see any bleeding, but this will be just in case. I'm preparing my 2x2 gauze, and we'll put that over the injection site. We want to clean the injection site with an alcohol swab again for a good 30 seconds. We're going to do that in a circular motion, starting from the inside, working our way out. And we want to make sure that it's all clean, again for 30 seconds. And then let's pretend that I've been wiping it for 30 seconds, and then we want to let it dry before we start injecting. I would just pop the cap off of this and make sure that the bevel is facing up. And then now that it's dry, we can grab our skin and then inject at a 45-degree angle. And then stabilize our needle. And then inject the medication slowly, not letting go of the grasp while we're injecting the medication. So now that the medication has all been injected, we can remove our needle and then activate the safety device. This will just go into the sharps container. We can put the gauze that we folded. Jake, you did really well. Thank you. Okay, so to make room for me to sign my MR, I would just move my patient to the bed. And then I would remove my gloves right away. And then throw that out. I'm gonna do another hand hygiene. And then I'm gonna sign my MR. So we wanna write down the time. So it is now 08:30. And then my initials, AC, and designation, UMSN2. So we've signed our MR. And then before we leave our patient's environment, we want to make sure that their bed is in the lowest position, they're comfortable, their side rails are up, their call bell is within reach, and we've mentioned what we're going to be assessing for a patient after administering the medication. So we want to document the vital signs on our flow sheet, and then also any assessment findings that we have, we all want to document it onto our patient's chart. And that is it. Thank you.